बिस्मिल्लाहिर्रहमानिर्रहीम। इय्याका नअबुदु व इय्याका नस्तईन। अल्लाहुम्मा सल्लि अला मुहम्मदिन व अला आलि मुहम्मदिन व बारिक सल्लल्लाहु अलैहि। Dear colleagues, I am Dr. Sultan Ayub, working as a radiologist. This is male child, almost 7 year age, with history of dysuria and burning micturition off and on. So I'm going to scan the pelvic region to evaluate the urinary bladder. This is urinary bladder, and here we can appreciate the cystic structure that is present within the lumen of the urinary bladder. If we closely observe, we can appreciate this area, this one, black. This is the distal ureter on the right side, and this we can appreciate the echoes coming from this area. This is the left VUJ, and on the right side, this distal ureter, when it enters into the urinary bladder. Look here. So then it is entering into this cystic area. This cystic area is mildly thick walled, almost rounded. Initially, the color was appearing, but that was not the vessels, only the artifact. So we can appreciate that this distal area of the ureter, when it enters at the VUJ, it becomes dilate. So this is the cystic dilatation of distal ureter when it enters into the urinary bladder at the level of vesico-ureteric junction. We can say that there is a sonographically, we can say this is the urine coming from the left ureter. So we can say that there is a cyst within the cyst sonographically. As this bladder is a cyst-like structure having anechoic fluid, and this is another cyst-like structure present within the urinary bladder. So sonographically, we can say that cyst within the cyst. Look at, sometimes it collapses and sometimes it dilates. Collapse is not too much, it disappears. Only we can appreciate that, okay, the size is somewhat increased and size is somewhat decreased in the other second. So this is called the ureterocele. This patient, we can say that is likely having right-sided ureterocele. This is the two type of ureterocele we usually try to describe. One, the intravesical ureterocele, which is present projects into the lumen of the urinary bladder, and other is the extravesical, we usually say the ectopic ureterocele. When we see the ureterocele, we should also see the ureter on the same side. This is the ureter. So this ureter is showing dilatation, and now we should also see the, look here, this is the ureter. If we feel difficulty, we can put the color to see the vascularity. So it is not vessel. So this is the ureter which is dilated due to the ureterocele. Then we should evaluate the kidney on the same side. So this is the right kidney which is showing minimal hydronephrosis, because this hydronephrosis is limited to the sinus. The minimal hydrocele size is a 7-year-old patient, the size looks normal. And then we also, what we should try to see the any duplex collecting system. Because ureterocele is usually associated with the duplex collecting system. But here we can appreciate the single collecting system. Look here, look here. And this is the another kidney, other side. This seems to be normal. So when we say that this is the intravesical ureterocele, usually this is associated with the single collecting system, while the extravesical or ectopic ureterocele is associated with the duplex collecting system. What happened in the embryonic life when the ureter is joining the, during the embryonic life, joining the urinary bladder, there is a thin membrane between the urinary bladder and ureter. There is some name I am trying to recall my memory, but name is not coming in my mind. So there is a thin membrane that rupture, and then the connection between the urinary bladder and ureter is established. While in the ureterocele, there is a failure of complete rupture of that membrane that result into the incomplete connection between the urinary bladder and ureter. I mean to say that this membrane is present, it is not completely ruptured. So this obstruct the urine outflow into the urinary bladder, and then this appears as this. Due to the partial obstruction, gradually the ballooning of distal ureter or intravesical part of the ureter is dilated. Gradually, it go on increasing in size with the passage of time and with the age advances. So here we can say that how we can describe it when that there is a mildly thick walled cystic structure projecting into the lumen of the urinary bladder on the left side at the level of vesico-ureteric junction that is demonstrating the decrease in size at one time and at the other time its size is increased. This cystic structure is almost rounded and it is causing mild dilatation of the mild right hydronephrosis and hydroureter, while the single collecting system is demonstrated. This was all about the intravesical right-sided ureterocele. Whenever we talk about the ureterocele, we should mention that it is intravesical or extravesical or ectopic. We should also mention in the report also. So this was all about the right-sided ureterocele. We can appreciate that the urine jet is demonstrated on the left side, while we cannot appreciate here due to this partial obstruction of this ureterocele. Thank you very much.